All right, everybody, how are you doing? I'm yours truly, Dr. Lastimado, coming to you from the Institution of Dental Advancement. That's right, dentalcetraining.com, and yours truly. We are excited about sharing with you new for 2018. You know, it was always interesting. Doctors would always email me or their friends would tell me, say, hey, I got a buddy, he's up in Tennessee, or I got a buddy up in Oklahoma. They really want to take your program, Dr. Lastimado, but they just can't make it here. Or sometimes I have docs, you know, everyone's really busy, right? Who has time? I always joke that no matter how much money you make, that's one thing we cannot buy is time. But I have some doctors say, Doc, you know, I just can't make this course. Do you have anything online? Well, yes, we do. Now for 2018, you can visit dentalcetraining.com, and there's a button now. There's also a little banner. You can click on it. It says online CE courses. And what's so awesome about it is that they are self-paced. You can do it at your own time. Right? You can do it at home, you can do it at Starbucks, maybe on a break during lunch, or maybe your patient canceled, whatnot. You know, nobody wants your patients canceled. But when you actually have time, you can take these online CE programs. The cool thing is that once you register, visit dentalcetraining.com, register as a student. Once you're registered, which is free, and you do take one of our courses, that registration never expires. So again, you can take it on your own time, whether it's now or a year from later or 3 years from now. It never expires. The cool thing is too, when you do take the time to take these programs, these courses that are online, you will receive AGD PACE approved CE credit. As I'll explain, we do have already a few courses with pre-release specials on that are already posted. But even best yet, right? Sometimes we've been to those CE programs and or online programs even, and we're listening to a speaker such as myself speaking to you as I'm speaking to you right now, and you're like, man, I can't follow along. So you got to stop and rewind, stop, rewind, fast forward. And so again, it eats up time. Well, before you take each program, you can go ahead and download and print out the actual lecture notes so you can follow along step by step by step through these online dental CE training programs. So, for example, really excited. It's already posted. There's a pre-registration special, so you can check it out. It's our Hollywood Results Smile Makeover Part 1 and Part 2. Right? What is it? Really, we know aesthetics are very important, right? And we know that in this day and age, you know, a lot of patients particularly have increased discretionary funds, and they're coming to you, doctor, for, hey, can you renew my smile? I want to refresh my smile, or I have this tooth broken right in the front. What do you think, doc? Am I a candidate for veneers? So Hollywood Smile Results Part 1, we have our patient, Christy, say, comes in, right, looking like this. She's got some broken crowns. You know, believe it or not, she's in her early 30s, even though she's got the smile appropriateness of maybe a 60 or 70-year-old, really dark, high chroma type teeth, right? And then we're going to talk about how do we get her to this, something very nice and natural, because that's what the patient wanted. So, Smile Maker Part 1, we talk about many things like spa, sex, personality, and age, right? How we take Mrs. Jones' personality, her male or female, and her age, and we incorporate it into her smile makeover design versus, you know, traditional just cookie cutter, stamp, stamp, stamp. And so Mrs. Jones and Mrs. Smith, you know, everyone's got the same smile, right? We want to create a custom, unique aesthetic smile. So we have to know some certain clinical techniques, some aesthetic techniques. Also, we do cover a little bit of gingivoplasty using our laser, soft tissue diode laser, to help contour the tissue. Now, even more exciting, we now move from that into the Smile Makeover Part Series 2. Right? Where again, we have our patient come in here, she's a nail biter or pencil biter, but she's coming to you, doctor, and saying, hey, doc, can you freshen my smile? So in Part 2, we take this patient and we bring them to this area here where we get a nice natural aesthetic design from Part 1. But now in Part 2, we start thinking about what type of materials do I use? What type of prep design do I use? Do I do Emax, layered, monolithic zirconia, layered zirconia? What do I use? Do I use felt-pathic porcelain? Do I use a high fusing or low fusing? And then once I figure all that out, that plan, as those of you may know me, but you'll hear now that I always say, doc, fail to plan, plan to fail. But doctor, if you take this time right now, maybe take one of our online courses, once you take that time and you create the plan, right? Plan to create. And what are we creating here in this program? Aesthetic results, okay? So once we get all that, how do we convey it to the laboratory now? That's the key thing. So that what we want is what we get back. And what we get back is what the patient now wants, okay? So that's what we're going to cover in Small Makeover Part 1 and 2. So hopefully you can see that. Also too, in addition to surgery, cosmetics, maybe lab-related, impression techniques and things of that nature, we will also be having online practice management and marketing programs. Doctors, stop spending the $80,000 a month, which I did, I used to, and you get maybe 2 or 3 new patients. Basically what we focus on here is how do we work together as a team through a 7-step process from A, B, all the way through Z, from your patient care coordinator who talks to the patient about finances, to your insurance care coordinator, to the gal or guy who answers the phone when Mrs. Jones calls for the first time. To also you, doctor, how do you get Mrs. Jones from no to yes? What do we bill? What do we charge? What our fee schedule should be? What are the CDT codes? It's really an A to Z practice management marketing program, which now soon will be online. Speaking of online, you can also visit us again at dentalcetraining.com and see what our colleagues are saying about our programs that they have taken. We've been extremely honored to have many doctors. Today I've trained personally close to 600 doctors now on live implant training surgery programs and other programs as well, but been very kind and very blessed for these doctors to share a few kind words. So at the end of it, visit us. Yours truly, Dr. Lastimado at dentalcetraining.com, coming to you today from the Institution of Dental Advancement to share with you for 2018 online dental CE programs. So hopefully we'll see you then and talk to you soon. Thank you.